David Morgan is President and CEO of Team Incorporated, a nonprofit helping human services organization serving over 15,000 residents each year through the Greater Valley region. An accomplished advocate for economically disadvantaged and vulnerable populations, David has served multiple Connecticut governor, Malloy and Lamont, and legislative appointments, Themis Claridis and others, including Connecticut assignments for human services. David is nationally certified by the U.S. Department of Health and Human Services and collaborates with multiple community, regional, state, and national initiatives focused on human services, early childhood, older adults, and anti-poverty social support and empowerment systems. So thank you very much.
Thank you, Deborah.
And we look forward to your presentation.
Thank you. Thanks for, I feel like I've come home again. I was just here. I had the pleasure of seeing the entire chamber board of directors a few weeks ago to talk around housing affordability impacting every walk of life. I'm honored, and I don't know how to say no to anything from the chamber sometimes. But I really am, and just hearing everybody's backgrounds and a number of partners in the room and on the screen who have been walking the very same path with Team Inc. So I very much feel like I'm home, but also partly singing to the choir, and deeply appreciate all you do and stand for. We look through the lens as a healthcare council. Just gonna, from the 30,000-foot level, speak to social determinants of health, which I believe you're all very familiar with. And my goal here is to just briefly dive into food insecurity and hold the mirror up to the community, as I like to say, with loving agitation to our beautiful Valley region, in which there's so much to be proud of, but we also have some work to do, and we can only do it together. The desperate reality is that you can look at one's, when you look at this infographic, the desperate reality is you can look at one's social, economic, environmental background. You can look at a zip code and foresee the increased likelihood of poorer access to healthcare, poorer health outcomes. And I don't say that from a doom and gloom. I say, again, with love and agitation, that demographic must not and will not be destiny, and that the more we kind of just have loving agitation with one another, those most affected by the issues, how do we get them at a seat at the table and have these deep conversations? And the reality is those disparities and disproportionate impact on health outcomes are very real. And it has a lot to do with those social and economic factors, more so than the healthcare, the access to, into the healthcare piece. And so everything we say should always begin and end with that social, economic, and environmental factors, in addition to health care, health outcomes, chronic health conditions, and so forth. And again, you can see the litany of the various social and economic and environmental factors across all of these columns. And again, my goal is just to give you a little brief tasting around food insecurity. This is a duplicative slide. The terminology shifts like the weather in New England. So the latest would be in what we're seeing in multiple spheres of bureaucracies and on the ground. Health-related social needs would be another phrase that you'll hear in addition to social determinants of health. And again, when you look at some of the, and I put as examples in here, the definition of HRSN and examples, I'm very intentional and deliberate about saying, for example, housing instability and food insecurity. When you look at the data for the social screenings that many healthcare institutions are doing, so when patients are going into emergency departments, going to see their doctors, nurses, various healthcare institutions, those institutions who are carving out that time to ask social screening questions around access to food, access to housing, how's the situation within the family, domestic violence, substance abuse, transportation, childcare, school age, et cetera, et cetera. The top three, housing, food, and transportation, right here in the Valley. So, and again, when you look at some of the research that the 80% of the health outcomes are just repetition is the mother of learning in my book. So it's really around the physical environment and the social determinants and behavioral factors that drive 80% of the health outcomes. Definitions matter. You know, when we say food insecurity, we spend a lot of time playing with words, and words change often. And I'm all for that. What really matters to me is what are the actionable, results oriented, what are the actions and behaviors we're doing to move the needle of progress individually, at a household, and above all at a population level in this beautiful, beloved Valley region. But the lack of assured access to healthy foods for a quality of life and active, healthy life. Just a year ago, we unveiled, many of you were part of this, and the entire Valley Council for Health and Human Services includes more than 40 not-for-profit organizations that pour themselves into the Valley region. Elected officials, mayors, first select people, all came together, and we do this every 3 years. It helps with the local Naugatuck Valley Health District with their accreditation requirements. It helps hospitals, including Griffin Health, with their regulatory requirements. But above all, it actually helps us kind of, Houston, what is the problem we have? Houston, we have a problem. Let's celebrate our successes and the things to be proud of in this Valley region. Let's recognize those strengths, but let's also amplify some of the gaps and the needs for improvement. And again, we can actually, it's very doable right here in the Valley. I often say, how do we just set the table? You know, one block at a time, one neighborhood at a time, one town at a time. Let's not get caught in the mud of, you know, state and national. We can actually be an exemplar here right in the Valley that can influence and inspire and for lack of a better word, evangelize other communities and regions near and far on the doability of moving the needle across a lot of these health factors and social and economic and overall well-being. Mr. Bill Purcell, right here in the middle, the chamber president, was on the panel. Dr. Reese Morales from the Ansonia Public Schools, Mark Abraham from Data Haven, out of New Haven, Mr. Patrick Charmel, Griffin Health, Jess Christie, the director of the Valley Health District. So just a year ago, we unveiled this 3-year report. It's over 60 pages. I did bring an executive summary. We'll pass that out before you leave, but you can find it online. And you can see the 6 key topics here where it talks about the changing of the Valley, who lives in the Valley, what do we know about the demographics and some of the trends of the Valley, community. There's a whole section dedicated on community health, another section connected to prenatal, expectant moms and to children right before they go into kindergarten, so that prenatal to age 5, seniors and older adults, a whole committed section. And I think you may all very well know off my cuff, I believe Connecticut is number 6 in the entire country as far as the oldest state. And when you look at the Valley region, we're actually outpacing the state of Connecticut. And I say that with two intentions. Number one, how are we responsive to the needs and wants of our greatest generation? And how do we harness the strength of our greatest generation, the wisdom, experiences, and knowledge transfer as we try to tackle very complicated issues, especially food insecurity, housing, economic opportunity, gainful employment. Forgive me, I'm singing to the choir, but all too times we kind of look at a population and think of it from a deficit perspective. We are sitting on a gold mine of wisdom and experience and knowledge. I make mistakes every day, and I always love to pick the brains of people in older age categories, so I don't have to repeat that. Or, oh, well, we tried that, so you need to recalibrate it a little. So it's a great section on seniors and a lot of their leaders in this room and others who really demanded, you know, when you look at the aging demographic of our beloved Valley region, we really need a dedicated section on older adults and seniors. Economic opportunity, and then community life in the Valley. There was a happiness and well-being survey, so you get to actually see what people are, not only what people need, but what do they want. You know, that's really important when you try to drive and find common ground and meet self-interest to build a stronger community each time. So I highly recommend that diving into that report that can inform your work organizationally and as a healthcare council. I did extract kind of 5 pieces from that 60+ page document with intentionality of connecting the dots to food insecurity. Giving you some data here on what the poverty rate is in the valley. This index, forgive me, it's Ansonia, Derby, Oxford, Seymour, Shelton, Beacon Falls, Naugatuck. So it's those 7 towns and cities. And so you look at, the poverty rate, which is this is the poorest of the poor. It is very outdated. It's not a good metric to look at, but the bottom line is it is the poorest of the poor. And that data metric came out from, it was originally within agricultural in the 40s and 50s, but it's still a very good metric to look at on those most under-resourced residing in our valley. And then the low income rate, which is 200% of the federal poverty level. The state of Connecticut recognizes that as the low income population. That too is outdated as well. We can all agree the cost of living in Connecticut will be different than the cost of living in Mississippi, for example. And so there's another one, the Alice threshold, which I'll get into. Give you a sense of the median household income in the valleys was about 82,000. I extrapolated a couple of examples within that region. Ansonia, 54,000, Oxford, 106,000. And then in 2020, when we looked at the regional data, the average wage of a job located in the valley was almost $8,000 below the Connecticut average. And 1 out of every 3 households in the valley are housing cost burden, meaning they're spending more than 30 cents for every dollar they're working their butts off for and for their loved ones. They're not waking up saying, I want to be poor today. They want the best for themselves. They want the best for their loved ones. And they're making really difficult choices. And when I show you later how many people from all walks of life turn to team, when we go down the hood and, they come in for food insecurity or other needs, and we do the full needs assessment, the common denominator is how much they're paying for the roof over their head, whether it's a home ownership or rental. When you start spending more than 30 cents for every dollar, you start saying, I'm not going to get those I'm not going to pay for those prescriptions, or I'm going to blow off this doctor visit, or I'm not going to pay this utility bill, or I'm not going to pay this obligation. And it can continue to spiral in very challenging ways. And then 15% are severely cost burning, meaning they're spending more than 50 cents for every dollar. Food insecurity rate in the valley is 14%. And when you look at family, it's 1 out of every 4 in the valley is experiencing food insecurity. I'm really trying to protect your time and stay within my time frame. So I could really dive deep on disaggregating a lot of the data, but I offer a couple of things here. Women are twice as likely to be food insecure as men here in the valley, and 40% of the valley students were FRPM, forgive the acronym, free and reduced program for meals. And so 40%, 4 out of every 10 of our students in the valley are income and categorically eligible to get free or reduced meals while they're at the public schools. And some of those numbers are even higher in certain school districts. This would be the big one that I would, if there was, in addition to the Valley Index, and looking at the latest Connecticut Alice report, another update just came out. Some will call that the working, or I would argue it's the working middle class everyday family. It's our friends, our family, our neighbors, and 4 out of every 10 are below the ALICE threshold. And ALICE, the acronym, I put it up there: asset limited, income constrained, employed. I printed this out, by the way, so I have plenty of copies for you to take with you. And I'll be happy to email this to Debbie. And what this means is it really looks at the true cost of housing in Connecticut, the true cost of childcare if you have young children, the true cost of what I call the pay to play stuff, for school age kids, to pay my taxes, my transportation costs, heating oil costs. Really looks at the true costs here in Connecticut, and they disaggregate it by town, so you can even pull out communities right here, beholden to the valley. And what we know, they call it the household survival budget. And so 4 out of every 10 households right here in the Valley region is making difficult choices, like I described before, in housing cost burden, but across everything. Do I put food on the table, or do I kind of, and food, and I appreciate your focus on this, because it starts with food. I mean, basic need, human need and sustenance, food and housing. Where do can't go any further than that. Obvious for me to point out. And then I pulled out, I disaggregated the data by 5 of the core communities that I know the Chamber and the Healthcare Council works very closely with. Ansonia is more than 1 out of 2, Derby as well, Seymour 4 out of 10, Shelton 4 out of 10, and yes, in Oxford, Teammate saw more than 500 residents from the town of Oxford coming into Team, saying, "I never thought I'd need to come here," and because people working their butts off, they're trying to do everything they can for themselves. I don't do this to be doom and gloom. What I do is like, we can actually solve this. I believe, you know, and I'm accused of waiting for unicorns to come out of the ground, but I believe, I absolutely believe we can actually eliminate food insecurity right here in the valley. I really do believe that.
Let's do
Say it louder.
Question.
it. Let's do it.
I have a question, because like we talk about this at Griffin because demographically, a lot of the low income population obviously has food insecurity, but then they're also sicker. And I know that there's a correlation, but then sometimes when people, is it, I guess because they're eating the wrong foods, is that what it is? Because sometimes they come in with like diabetes and a lot of things that can be solved by eating healthier foods. And, so how is that correlated with the healthcare and the?
Great question.
Yeah.
Can I hold it for a
Yeah.
couple of slides?
Oh,
That's a
okay.
beautiful question. Absolutely. I forgot to step back and, you know, Debbie, great introduction on teaming, 2 leaders here, NJ, Jillian. In the last year alone, we saw just over 17,000 individuals from turn to team in the last year alone. You can see our community footprint where we've got Milford in the house, excited to hear that. But we're on the ground from Milford up to Waterbury. And our largest numbers of services are coming from Ansonia, Derby, Shelton, Seymour, and then followed by Milford. And then on the periphery, what we're doing in Naugatuck and Waterbury is very specific to early childhood only. It's not the whole array of housing and social support services. And that would be another chapter, but the feds had leaned into team as far as seeing how well team was doing historically in the valley. In Naugatuck and Waterbury needed significant help with their federal Head Start program. And so we were, we've been making a meaningful difference in the early childhood arena in that area. And again, just to look at, when you look, the 17,000 is a 14% increase of children, adults and seniors from the prior year. And by the way, that was an increase from 2 years ago when it was a 25% increase from 12,000 including the pandemic. Like many of you, team and the staff never went home throughout the pandemic. This is just a snapshot, an attempt at a one-pager of all our different programs and services within Teammate. I made a point to highlight the areas specific to addressing food insecurity, and I'm gonna protect your teams and skip through that. Very intentional about how, you know, if you walk away thinking about food insecurity, I also hope you walk away thinking about housing, because this region and this state will sink without a housing fix. This is an infographic, a little bit, it's going to touch a little bit on a great question, but it's our case management approach, and it's the art and science of working not just for people, but with people. And, you know, sometimes, I'll temper my words here, but sometimes we get stuck in this savior syndrome or lecturing others. And, you know, how do we actually empower individuals? Are the experts in their own lives. Listen to them, co-create with them, and plan with them. And how do we eradicate obstructions and barriers through no fault of their own? And it's a beautiful thing when you see it happen, and then team just gets the hell out of their way and they're thriving. Progress moves at the speed of trust. If I don't trust you, I'm not going to share what I'm experiencing. And this is my life. I want the best for myself, and I want the best for my 3 kids and my wife, et cetera, et cetera. So I'm gonna, you know, I could go on and on about this infographic, but this is team's attempt to really talk about from the point somebody connects with team and the art and science of working with somebody, including behavior and food, which I'm gonna go deeper into. But all too often there's all this, hey, you need to, I mean, we learned this with vaccine outreach throughout the pandemic, like, right? Okay. And if you have kids, you know, you know, it just doesn't work. You really need, there's an art and science to it. And so this is our infographic on that. And we're trying to implore our partner food pantries. This is our 5 within team on what we look at in housing and food insecurity are 2 of the big key ones. The other 3 is childcare, or the inability to access childcare when corporations and businesses, including some of you maybe in this room as employers, hey, we got our workers back, except for the ones that can't find childcare. Childcare was already such a vulnerable industry, and the lack of an adequate public investment in it, like there is in K-12, really amplified throughout the pandemic. Team was one of the few that we provided childcare for healthcare workers who are doing God's work, saving people's lives, treating sick people in the most terrifying times of COVID-19. Their childcare programs, they did not survive through the pandemic. They were so vulnerable beforehand, and they're gone forever. And there's some that are just a shell of themselves. And childcare works, so parents can work. 1 out of 3 workers in the state of Connecticut have a dependent. And again, we learned all this and it got amplified in the pandemic. But now it's kind of out on the periphery. And I think there's some other issues to it specific to gender and race and ethnicity as to that it continues to kind of like, why isn't this right in front of us? Childcare is such a critical pillar, just like housing. And then the most powerful social program is gainful employment, a living wage job. Okay, so I'm going to close up on how we can eliminate food security. So one of the things that team, well, how am I doing on time, Debbie? How much time do I have?
You're good.
I'm good? Okay, all right. I thought we can go under 10 minutes now. Team got national state recognition with our diaper bank, where it was such a beautiful, powerful way to connect with hard to reach families. And there's no, like, you couldn't use WIC to buy diapers. You couldn't use SNAP, formerly known as food stamps. There's no public assistance for diapers. And so families were making very difficult choices around the diapers. And a lot of studies came in. I mean, even Yale that picked up national attention. Connecticut Health Foundation, Child Maternal Health Journal, American Academy of Pediatrics. There's so many studies out there about the correlation between health outcomes and to diaper need, not only for the young child on the diaper, skin dermatitis and other chronic health conditions, but the Yale study, maternal depression and confidence and mental health connection correlated to diaper need. So we incubated it about, we were able to incubate it out of the American Recovery and Reinvestment Act, President Obama. And then from there, it partnering with like Griffin Health and many other benevolent donors, our ability to reach hard to reach families and to connect with team. And again, progress moves at the speed of trust. I liken it to, sometimes we just focus on the relief giving. Here's the food, here's the diapers, here. But, I liken it to the Shelton mother. This was before the pandemics. If anybody has had to walk into a food pantry, for example, how do I describe it? It's when I went in there for my 2 babies and, for my wife, and like, you don't even want anybody to talk to you. Okay, you just, you feel like you let, your family down, you let their extended family down, and you're like, but my baby needs milk, so you don't want anybody to talk to you. And it's not like personal. It's just like, I can't believe I'm in, and so you walk in and you get your stuff and then you get out and want to be invisible. My point of that is that, so this mom, and I'm going to really take some shortcuts here to protect time. She comes in the first month, grabs some diapers and he gets out, comes in the second month, grabs diapers, gets out, comes in the third month. We do that earlier infographic, building trust and connection, cast no judgment. We do give tough love, but we cast absolutely no judgments. She finally starts opening up with her staff about she dropped out of high school and, where's she going in life, and et cetera, et cetera. Long story short, she gets into Valley Region Adult Ed, she gets her GED, and oh, by the way, from there, she went through the Healthcare Career Academy, and it all started with relief giving of diapers. So never underestimate the power of, it's about the human connection. And to me, if you have, never have low expectations of anybody, like, never get stuck in, oh, I feel so saintly. And it's good, it's beautiful. We want to help and pick each other up, but always think about empowerment and listening to others and building that level of trust. I went on a tangent there, but I'm gonna go back to the food here. So we got asked by the Connecticut Food Bank, they're called Connecticut Food Share now. Hey team, you're amazing. Would you be willing to open up a food bank? And we do so many referrals to food banks and food pantries. We said, well, wait a minute, there's already multiple food pantries right here in the valley. Serving Seymour and Oxford, Ansonia, Derby, Shelton. We don't want to just create another food bank. And I think, you know, sometimes we create all these silos and it can really be the undoing of progress and building coalitions and community, you know, stronger communities. And so we said no. And we said, you know, actually I said no to my, the CEO team at the time, said no, let's actually, there's already these champion food, but let's get them in a space together. Imagine that. Let's actually work together. You know, let's get in a space. Wasn't easy, you know, partnerships, you know, there's probably, right, you guys are competing with each other, right, and stuff like that. So, but trying to get in the room together and you know, with the eye and the pride, but you know, stronger communities, person-centered, and so, you know, I'll skip all those steps, but finally got a coalition of food pantries. It's now 8 pantries now right here in the valley. We meet regularly and we adopted nutrition guidelines. So, and I'll use one anecdote. I remember with the group and somebody said, you know, because I started asking about what are we putting on the shelves in these food pantries? If the research shows.
Like mac and cheese and stuff.
You got it.
Yeah.
Yeah,
And
starch.
then shelf stable.
Yeah, well, and I like to say it this way, team does a terrible job educating its donors.
Yeah.
Do we tell our donors what we need at the food pantries? Because you're right, we get mac and cheeses, we from BJ's and I heard Stop and Shops in the house, you know, sheet cakes and, you know, all these, you know, and when the research shows us, you know, and I'm liking it to one person saying, David, gosh, this healthy approach and these, what are we putting on that? I'm just trying to do God's work. I'm just trying to do God's work. And I'm like, I hear you. I think that's great. You're doing God's work. However, 1 out of 3 individuals walking into these food pantries with type 2 diabetes, other chronic health conditions, and they're pouring into team, right, Jillian MJ, with these unbelievable medical bills that there's, you know, and that, are we still doing God's work? You know, and guess what? Middle class and upper class, I don't care what your income is, we all get influenced by marketing and how we set things up. You know, whether we go into, you know, Stop and Shop and Big Wise, how things, there's a lot of deliberate intentionality. We can actually do that within food pantries, and we can actually commit to nutrition guidelines, and we can really commit to communications on educating our donors, here's what we really need. You know, and you know, we've done there's some links here, you know, I'll share, but they need help and they need healthy foods. And this is the part of like kind of the loving agitation, I call it, with the pantries. Like, you know, it's easy for me. I'm not running the pantry, right? Hey, we need to do this and this and this. And, you know, and we get into these philosophical conversations around like, you're never going to change those people. Well, that's ridiculous. Then why are you even running a pantry? I mean, if that's the mindset and if it's not true, you can actually do healthy nudges. We can do, you know, food is medicine research. There's all kinds of stuff that's swapped, supporting wellness at pantries, where you really geek out on how you set up your program, how your policies are, how you respect and provide dignity, you allow free choice and shopping at food pantries. The quid pro quo though is you can't just lecture pantries and so forth. It's like, so what I did is I went to Bazzuto's Incorporated. And MANA stands for Mobilizing Action for the Nutritional Needs of All. And as I end here, I you know, if you ever wanted to volunteer and get a sense of this, it could be kind of a cool healthcare council morning. You're right in Seymour, because I mean, I'm biased, I've done it, but when you're there, you just like, wow, I haven't done something like this in a long time. This is really good. MJ just did it 2 days ago. You should do that. So I went to Bazzuto's, which is in Cheshire. They are the wholesale distributor. They go out to Ohio, all the way up to Maine, very large. They happen to be right in Cheshire. Anything you see on the shelf, Adams, Big Wise, ultimately comes from them. I liken them, and when I went there, I would say it was like the size of like 10 Home Depots or Lowe's, all in one building, and these trucks zipping around, employees with refrigeration units, freezer units. And so I talked about food insecurity, talked about the cause with the leadership. And my ask was, would you be willing to sell foods at cost? And I said, you know, we're raising funds, 100% of the funds buys the food. It doesn't go anywhere else to overhead or anything. We have volunteer capacity, we have infrastructure. They said yes, but you need a loading dock, Dave. I'm like, a loading dock? I'm just a little nonprofit. So I went to Larry Janeski, Connecticut Basements, now Systems, now known as Contractor Nation. Long story short, they allow us every month. We use building number 9. They got a great, and they are a busy operation. I mean, they're all across the country. They're in Canada, they're in England, and they allow all these obnoxious, including me, nonprofit folks and volunteers, like this mini invasion. But it's like a it's about a 2-hour experience in a morning during a weekday, where the Bazzuto's truck backs right in, Contractor Nation. Show you some pictures here. I'm going to give you a sense of how many people, by the way, right here in the valley, because some people, and I say this with love, some people don't know, or some people don't want to know. It's all about, this is a beautiful valley, it's unicorns and rainbows, and thank goodness everything's wonderful here. And I say that with love, but that's not true, because my staff are pouring themselves into it every day. I mean, I'm actually selfish in some ways, like, we have to solve this, because you saw those numbers earlier. The tsunami of need is just so, in the housing one and the food one, it is really keeping us up at night, as I heard someone say earlier. But 69,000 pounds of food. Pounds is the universal metric. So when I first brought those pantries together, it was bonkers trying to, you know, how can you hold the mirror up to the community when you get all these different answers? Like, well, we measure in bags, we measure in boxes, we measure in meals. What I call a meal might be different than what MJ calls a meal. So we were looking at some of the national and state research. Pounds has become the universal metric. Well, David, what the heck's a pound? On a large scale, 1.2 pounds equates to 1 meal. They've done it enough. I mean, you can pick on that if I just take, you know, 2 cans and a gallon of milk, but if you really put it on a large scale, it's very reliable. So 69,000 pounds of food equates to 57,000 plus meals every month coming into these pantries. Just over 1,700 individuals. By the way, over 300 of them are older adults over 60. Okay, and then another 500 plus are kids between the age of 18, and then the rest fall between 19 and 59. Oh, and I skipped we have a lot of, local businesses have started to get meaningfully involved. Griffin's Health Services has been the key contributor. Haynes Group, Mr. Tom Haynes, actually was sitting right there at the board meeting, they've contributed to this. Some of our teammate donors and foundations who have been so benevolent with like our elderly nutrition programming and Meals on Wheels. I asked them, could you dig a little, would you consider, and so they've added to it. We're still trying to, my whole point of this is because we get the at cost thing with the Zudos, it's on average 25% less in cost than if you went into the local stores. And by the way, these pantries are small but mighty. They do so much with such little resources of staff and volunteers. So when these trucks pull up with all of this poundage of food, they just, guess what? They just save their time getting their damn car, getting the shopping cart out, using their donations to, pick out the food and then come back. I mean, this is like literally landing on their stoop each month. It's only $1.86 a meal. And these are just other images of the foods. This is Connecticut Post and some volunteers from Seymour. There's Griffin, here's one of the food pantries, Seymour Oxford Food Bank. Jeremy Radke, Better Packages, a hallmark in the Valley, 100+ year business. They've been behind this. But again, it's the dairies, it's the proteins, it's the fruits, it's the vegetables. This is the stuff, we've even had some volunteers and board members of these pantries saying, my gosh, I want to shop at my own pantry. More than I want to shop here. And then I'm going to do a disservice here, but I hope you got a little sense of there's where we do written agreements with each pantry. It isn't we just bring the food, like you're going to work on nutrition guidelines. We're going to work on promise and practices like SWAP, and there's some other areas. We're going to have standardized data collection. It was not easy to get everybody to agree on a shared measurement, and we got them scales. I couldn't tell you, what the level of need was and our capacity to respond to need, because nobody was working together, nobody was measuring the same unit. And then we're looking and we've done some research and best practices. We're actually putting federal attention on this. Hope Spring is Eternal, that I believe, I'm biased, I'm in it, but I believe it can be an exemplar to scale out on a national scene over time. And our ability to leverage additional resources. And when I email this out, and I also printed these out, I might pass them down, but that's the whole presentation. But each of these are all linked. We just started right before the pandemic. You talk about this universe. This thing was the lifeline for the food. Everybody ran to the hills. If you were already off the list under resource, it was terrifying in March, April, May, June 2020. This thing was a freaking lifeline. So I thank you for your time.
Thank you. Questions or comments? Do you do any of the work with the school children how do they get the meal assistance when school is not running?
So yeah, great question. So there's a summer food program where it's through the Connecticut Adult and Child Care Food Program, where summer sites are set up throughout the summer. Sometimes at some of the elementary schools, some of the local churches will do them. Boys and girls clubs will do them. Some of the Bible schools will do them. And the whole intent is to ensure that kids can still get that access when school is not in session during those summer months. And they're hitting the pantry too.
I don't know if you can comment on this, but over the same period that you've been talking about in these numbers, we've seen a lot of rising wages, mandatory wage increases. All of my workers are hours workers. They're making a lot more today than they were, but the numbers don't bear out that it's having much of an impact. Can you comment on that?
The comment on the rising of the wages?
Just the rising of wages and whether or not that's actually pulling people out of poverty or helping overall, because what I'm seeing over the same period of time, a lot of, 25% and then another, 17% or something of people coming to you. Is it really having the follow-on effect? Is it really helping people?
That's a really deep question. It's a great question.
Yeah.
The challenge is the inflation, especially housing, is far outpacing the cost of living adjustments on
All those
people's
wage
compensation.
increases are just being eaten away by ever increasing, mostly housing costs.
In my humble opinion, all roads lead to the housing crisis. And that's why there's a people shortage. That's why there's a workforce shortage in Connecticut.
Yep.
Correct me if I'm wrong, but that's somewhere between 8 and 11% housing increase, right?
Well,
Up and down the valley.
Just in a 12-month period, there was, I'll throw this up for you, Debbie, that I think you'll appreciate. This was actually the housing piece with the Chamber Board of Directors.
That we just had,
Yeah, and I'll just show you one slide that, just in its like Derby, there's some Manhattan rates in the city of Derby, and from November 20 to November 2021, there was an 8% increase just in that 12 months on the housing, on the rental cost. And we can all agree nobody's wages went up 8%, and just in that one little 12 month snapshot.
I recently was divorced and we lived in Ansonia and I was looking for an apartment kind of anywhere. I'm in Milford now, but everything is over $2,000 a month.
Yeah.
Everything, Derby, Ansonia, and then they have put those new, and then I have some, they put those new affordable housing downtown Ansonia on Main Street. And they're really cute and everything. I look, they're not cheap.
No.
How is that affordable? They're like $2,000. That's not affordable. I don't think. That's, and I don't consider myself in the poverty level, but I'm kind of close. And I'm one income and it's like, how is that affordable? Those little cute little downtown apartments.
This is a whole other.
We're still stuck on decades of stigmatized thinking and really bad decisions where we segregated, warehoused poor people, especially categorically, I would say Black and brown populations. Olson Drive, the stigma, Ansonia. And so when we say affordable housing, people are immediately okay?
They think it's gonna be like
Not-
trouble
no.
and that, yeah.
I'm gonna do it again, I'm looking for the bananas, but build absolutely nothing anywhere near anyone, NIMBY is the other one, not in my
Mhm.
backyard. To your question,
Yeah.
the average, and this number is skyrocketing, I mean, I had to keep updating this,
Yeah.
as I pull it. The fair market rate, and this is lower than the normal rate, but to your point on your Ansonia example, for a two-bedroom apartment right here in the state of Connecticut is just under $1,700 a month. And for a one-bedroom, it's kind of tiny here, it's 1,350 a month. So if myself and one other are in a unit, let's say me and my daughter, I gotta be making almost $32 an hour to stay under that 30% threshold I talked about earlier. I gotta be making just under $26 an hour.
But
So
those
to
places
your
are very
question
few and far between.
Yeah,
on wages,
not helping at all.
and look at all these occupations, I didn't
Right.
put all their labor
Yeah.
wage, but our childcare workers, our entry-level healthcare workers, our
Yeah.
paralegals, our manufacturers, our bar workers, our restaurant workers, I don't know if I really do, but I see you guys all at the bar all the time, those are the people you're talking to at the restaurant. I don't really go to the bar, I just made that up. And then the people shortage, so housing is why, no offense, mom and dad, but the Gen Zers and millennials, they wanna live with you forever. And now dad's starting to get mad, because his 25-year-old daughter can't move out of the house, and he loves Derby. And like, oh my gosh, my daughter can't even find a place where I raised her. And the 79-year-old woman in Oxford, I was doing a little focus group with a whole bunch of older adults in Oxford. So David, I raised my family in Oxford. They're all grown up. My husband, my loving husband, God rest his soul, passed away. I'm all alone in this unbelievably oversized Oxford home. Or to downsize in the very community. I loved my husband and I raised my family.
Yeah.
It's far more expensive.
Someplace to go.
Nowhere.
We gotta fix this. We gotta fix it.
Anybody online have any questions? Maybe you could help us here, Nancy, 'cause
When you get this thing on there. Food is like, what's beautiful about this food effort, and again, a number of my invitations into the work, like maybe a healthcare council, volunteerism, like food. Before the sun sets, I can make a difference. I can move food from point A to point B and help someone, a household. Housing's not like that. Housing is just like
Right.
5, 10, 15 year, and people are like, oh my gosh, it's so complicated. I don't even know what to do. I can't make it there, which I don't agree with, but so food has really been, Maggie, like, it's very intentional when I'm there at Contractor Nation and I'm talking to, corporate leaders, CEOs, and like, you start to peel the onion and slice through the veneer of like, why are there so many people in the land of such abundance experiencing food hardship? And then you get to talk about older adults with fixed incomes and Social Security. This gentleman was saying about, the missed opportunities of additional benefits. Eventually the road gets into the housing, if you can tell, I'm pretty.
Yeah.
Yeah,
It's
no,
always
it
back to housing.
eventually always does go back to housing, but,
Yep.
the pop-up of like the purple pantry boxes. We've got how many now in the valley? There were none when I first came here.
Yeah, so we have the Little Free Pantry on Skokrat and Seymour. We got
Right.
the Neighbor to Neighbor Pantry in Oxford.
Yes,
And then Christ Episcopal in Ansonia, Greater Valley Salvation Army in Ansonia, St. Vincent de Paul in Derby, Seymour, Oxford, Spooner House in Shelton,
Right.
Food pantry in Shelton.
That's what we donated.
and the Blessing Pantry at Trinity.
and there's the one on Church.
Every dollar,
I like that.
I want to be really clear about this, every dollar buys the food. Because, and some people in this room who have done it, we have the volunteers, we have the infrastructure, we just need the healthy foods.